you for joining us for this segment of Live Healthy. I'm Lauren Collar. Today we're discussing palliative care, and joining us is Dr. Gregory Compton, the Director of Palliative Care here at Trident Medical Center. Thank you for being here.
It's a pleasure.
Starting with palliative care, what is that exactly?
Well, actually, we use the term here, supportive care, not to deflect from the answer to your question, but it's easier to explain to patients. It is helping families and patients understand the gravity of their illness, making sure they have all the information they need in the hospital so they understand the nature of their illness, and then having them establish goals of care with that information. Principally, it's aimed at people with chronic conditions or multiple conditions that have life-limiting illness.
How do you decide, how do you determine if that is what they need?
Well, a principle of palliative care is that it's available to patients as they look forward with their chronic illness, look into their chronic illness. This begins really in the doctor's office. So the doctor explains that somebody has a chronic condition like COPD, heart failure, a malignancy that may not be curable. Palliative care or supportive care can begin years before their anticipated death.
So when some people hear palliative care, they think it's at the very end, but in reality, people can get this much sooner than that.
Absolutely. In fact, we try to distinguish palliative care or supportive care from hospice, which is really in the last roughly 6 months of life. So you can have an understanding of your illness. In fact, you should have an understanding of your illness as early as possible, and then work with your doctor or doctors to tell them what your goals are. Some people want aggressive care to the last. Some people have a malignancy and they don't want to go through the chemotherapy, for example.
Thank you, Dr. Compton, for joining us. And thank you for joining us for this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.